A lot of health professionals are using platforms, especially like TikTok, to create short, informal videos that provide bite-sized pieces of information about cervical cancer screening and other important health preventative behaviors and tests that can be done to try to reach a younger audience. So, we know from prior research that I've done and that others have done that young women especially are using TikTok to find answers to questions that they have about health and are just using it as a form of entertainment and coming across health information in the midst of that. And so this is a good way for different health providers to be able to meet them where they're at and provide them with important information they should know. Yeah, so based on this study that my co-author and I completed, TikTok is a way to visually bring attention to what PAP tests are and what they include. So a lot of health professionals are demonstrating what is included in a PAP test. So they're showing the actual tools like the speculum in their videos. And what we found is that increases interest in the videos and helps to inform young women about pap tests, and rather than scaring them away from getting them, it's actually providing them with important, useful information. Specifically, when that demonstration video is paired with information about what pap tests are and why they're important, that's a very effective strategy. So young women want to know more information about what the test is going to include and why it's needed. And so if we pair all of that information together, the visual of what the test looks like and how it's done, but then also like spoken dialogue over what the test includes and why it's needed, that's very effective. However, we did find that if we show the speculum and talk about possible pain and discomfort in the videos about pap tests, even if we're talking about it from a perspective of there's ways to try to mitigate pain and discomfort, for example, asking for more lubrication jelly to be used or a smaller speculum to be used. If we show that medical device, the speculum, and talk about possible pain and discomfort, that is not effective because that can be a little bit too overwhelming and cause people to defensively react to the message and be a little more fearful and have lesser intentions to get a pap smear done. Yeah, so it's a very accessible way to meet people. So in today's day and age, we as humans, we want information fast. If we can get an answer right away by going online, then we're probably going to do that rather than waiting to talk to our doctor or get an appointment scheduled. Short form video is also more accessible in terms of like cost. So not everybody has insurance or money to be able to go to the doctor. So this is a way for them to still get information to important medical questions without having to go to the doctor's office. It's also just a way to, like I said, meet people where they're at. So, not everybody knows that they need to have pap smears done. That's actually one of the biggest barriers for young women is that they just don't know that they need to do them. So, if we can show up on TikTok talking about pap smears and increase their knowledge and knowing that they need them, then that can spark that interest in them seeking that out with their healthcare provider. Yeah, I think just being where they are and providing them information is important, but also being willing to answer any questions that people have. So that's another perk with social media is that certain health topics are uncomfortable and maybe taboo to talk about in person with a provider or with a stranger. But when it comes to social media, we can seek information anonymously and not have to feel shame or embarrassment in asking questions that we might have. So, by trying to anticipate what questions people might have or what information they might need and providing that information online or ahead of time, in a clinical setting without having to wait for people to ask those questions, that can be helpful too.